PhilHealth, presidential spokesperson Harry Roque demands the agency shape up. He says the universal healthcare law won't succeed if PhilHealth won't root out corruption. We go above and beyond the headlines with PhilHealth spokesperson Shirley Domingo. Ma'am, good evening. Thank you for joining us.
Hello, good evening, Pinky, and a good evening to everybody who's listening.
Yes, ma'am. This is Pia Ontiveros.
Pia, I'm sorry.
Ma'am,
I'm very
I'd
sorry.
like to begin
Pia.
with Harry Roque. He says that he is apparently he's really going after your boss, PhilHealth President Ricardo Morales. What does the PhilHealth think of this?
Well, he was saying that the reason for that is because of our statement that we will be delaying implementation. Actually, we have been starting to implement universal health care already since last year. The fact that we implemented every Filipino is already a member of PhilHealth with immediate eligibility to the benefits. This is already part of universal health care. What we meant only was that some activities such as the outpatient benefit package might be delayed a little bit maybe next year, but groundwork for that program is already starting this year.
Okay. Well, he did hint about hint lang naman no, about having your boss, your chief replaced. Hahanap ng iba.
Hello. Hello.
Yes, ma'am. Did you hear me?
I'm sorry.
Yes.
Yeah,
Hello,
can you please
ma'am. Can you
repeat the
hear me?
question? Yes. Yes. Now, yes.
Yes. Well, Secretary Roque did hint about having your boss replaced, that he could be replaced.
Well,
Ma'am?
yes. Well, as everybody in government says, they serve at the pleasure of the president. So if this is the pleasure of the president, so be it.
Has PhilHealth been able to finally work on these reimbursements for hospitals? On May 4, I was speaking to your chairman, and he was telling me that 12 billion yung return to hospitals account, but you've been able to bring it down to 7 billion. That was May 4, no? So we're a month and a half since then. It's been a month and a half since then. Has there been an improvement in this regard?
Yes, you see, the return to hospital claims are with the hospitals unless they refile it with us. Therefore, the statement that we owe some hospitals in billions of pesos, it really depends on the claims that they file again with us. We tried to look at our data. There were some denied claims aside from the return to hospital. And we could not reconcile the figure that was given to us that we owe. And therefore, we're really pushing for accounts reconciliation of the hospitals with our regional offices.
So denied claims, regional hospitals, ma'am? So merong mga
Yes,
denied. Can you tell us
yes.
What is the amount of these denied claims?
Well, I don't have the exact figure at the moment, but claims, when given to us, we assess according to its completeness in required data or attachment. So they can either be denied or they can be returned to hospital or paid or in process. So we tried looking at our data and we couldn't reconcile the data that they said we owed the hospitals. And therefore, we're pushing really for reconciliation.
Are these regional hospitals lang po or
no, all hospitals?
May kasama po bang mga ospital na malalaki dito sa Metro Manila?
Actually, all hospitals because all hospitals can have either denied or returned to hospital claims.
All right. And one final question, ma'am. Kanina ang sabi ko na nga is, according to Chairman Morales, 7 billion yung IOU ng PhilHealth sa mga ospital. May 4. So a month and a half since then, it is still 7 billion in other words because like you said, ang dami pang mga denied claims.
Yes, actually, it's not an IOU. This is the return to hospitals. And therefore, we have been trying to bring this down, but the hospitals has to refile these claims with us. And therefore, we cannot act on these claims unless they refile it again with us.
Okay, so 7 billion. So you mean they have to keep refiling it until you decide that you will give it to them?
Well, not
At
keep on
7 billion pa
refiling
rin,
it.
in other words.
Yeah, we returned it to them for some reason, either attachment or lack of data. And once they refile, they're given 60 days to file it again with us. And once they refile it with us, then we will process the claims if complete and if good claims. Therefore, it's since we returned it to them, it's really the ball is on their side to give it back to us.
All right. Shirley Domingo, PhilHealth Spokesperson. Ma'am, thank you very much for joining us this evening.
Thank you very much.
The winged jewel has been around for quite